Hi, this is Jana Salmon, and I'm so happy to be here today to talk to you about breast exam comparisons. I've been the owner of OC Breast Wellness since 2009, and though I'm not a doctor and I've had no medical background, after doing breast exams through many different technologies over the last 8 or 9 years, I think my experience could count for something, and I'm happy to share that with all of you. In 2008, a mammogram ruptured my breast implants. It was one of those experiences you never want to forget. I knew she hurt me. I could tell, but of course the technician ignored it and said it's probably a pulled muscle, nothing to worry about. It took about 3 months for me to get an MRI, and they noticed not only was the left breast ruptured, but the right one was also ruptured. Now, luckily for me, it had been 17 years and I had developed a lot of scar tissue. So the silicone did not, enter my body. It stayed in the capsule. Now I had surgery and I had an HMO at the time, so they just picked a doctor out of the blue. When she got in there to clean my area out, she said, "Well, I got to put 100 cc's more in each side because now the space is so big." And of course, I wake up to these huge breasts. The next day, it turned out she didn't cauterize one of them right, and I had to go back into surgery and have it done again. So the experience was nothing to brag about, but I'll tell you, well, the one thing that did come out of that experience was I was determined to find a technology somewhere out there for women with breast implants. Especially in Southern California, almost everyone has breast implants. And why should anyone have to go through what I went through just because it'd been 17 years or 15 years? And the mammogram technician had absolutely no tact for how to scan a woman with implants. I mean, I realize mammography cannot see through breast implants, but because of the way she had to move the implant out of the way, she actually ruptured it. After that experience, I was determined to change the future of breast exams for women if it was the last thing I did. So I opened OC Breast Wellness and I started researching different types of technologies that would be safe for women, would give immediate results, would be pain free, would be radiation free. It seemed like an impossible task, but it wasn't. I found two technologies over the last 8 years that I'd like to introduce to you and also tell you a little bit about current technologies and why I think that women need to have more than one breast exam in order to get all the data they need to make a good decision on their breast health. Let's start with mammography. Everybody knows what a mammogram is. It's an x-ray of the breast tissue. Mammography is old technology. It's been around since the 60s. It has lots of limitations, and I will go over them specifically so that everybody understands them. Of course, we know it's painful, it has radiation, and it takes weeks to get the results from a mammogram. But it does have one benefit, and that is that it's covered by most insurance companies. One of the limitations of a mammogram is that it does not scan the entire breast. So if you've not had a mammogram, then let me explain the process. You have a machine with two plates of glass, and you have to get the breast tissue between those plates of glass so it can take a picture from the bottom and from the top. So the only way to do that would be to lean over and put the breast tissue that's hanging off the body between those two plates of glass. Now you can see by these pictures, here the one on the right hand side especially, that the breast tissue comes up high, up to the collarbone, goes under the armpit and down below the fatty part of the breast. So mammography is only getting half of the breast tissue. And if you look at statistics for breast cancer, 54% of all breast cancer is in the upper outer region. That's right under the outside of the armpit area where there are lots of lymph nodes. And this part of the breast is not scanned by a mammogram. The next limitation for mammography is that it cannot see through breast implants. Now, this is a really important factor, and it's what happened to me. The implant itself had to be moved out of the way, and you can see how it sits in the breast tissue. This is not easy to do. The technician has to force that implant up against the chest wall in order to take a picture of the tissue. And most of the time, you have to have 4 extra pictures taken, 2 for each side. And we're going to talk about the amount of radiation that's causing later in another slide. A really important factor to know is that mammography cannot tell the difference between dense tissue and tumors. And here's some great examples. If you have extremely dense tissue, or maybe just regular dense tissue, and you have a tumor, the x-ray is going to look the same. You're not going to be able to tell the difference between the dense tissue and a tumor because they just show up white on an x-ray. Now, the California state has a law called really the dense breast tissue law that says if you have dense breast tissue, you should not be having a mammogram, and your insurance should be able to cover another technology. A couple of years ago, I met a radiologist who said that she had missed a tumor the size of a golf ball because the patient's tissue was so dense. And here we rely on this technology to locate breast cancer. Most younger women have dense breast tissue, and it kind of thins out over time. I always use the expression that the breast tissue is like a sponge. When you first get that sponge, it's nice and thick, okay? And it absorbs really well, but over time it thins out. And if you don't know what kind of tissue you have, make sure you ask. My last and final complaint about mammography is the radiation. Yes, it is an X-ray and it contains ionizing radiation. So that's not the kind of radiation that comes from the sun. This is the kind of radiation that actually damages your DNA and it cannot be replaced. Radiation is measured in sieverts, and the best way to explain this is that there is 1 sievert of ionizing radiation in a chest x-ray. Now a chest x-ray is 17 by 17 inches, so it's taking up a large space of your body when you get that 1 sievert of ionizing radiation. A mammogram, as you can see from this chart in these little boxes, contains 20 sieverts of ionizing radiation per picture. So imagine having 2 pictures on each side, or maybe 4 pictures on each side for those people who have implants. That's a lot of radiation. It's not like flying from New York to LA. It is not something that you can just blow off. It's 120 chest x-rays. If someone said to you, I want to take 120 chest x-rays of you, you would definitely say no. You wouldn't even think twice, but you'd have a mammogram. Another way to look at this is that mammography increases your risk of getting breast cancer by 3 to 4% every time you have a mammogram. And this is cumulative, so ionizing radiation doesn't go away, it accumulates. So every time you have a mammogram, you're increasing your risk by 3 to 4%. When I first decided to change the future of breast exams in 2008, the safest technology I could find at the time was breast thermography. Now, thermography uses pictures to study the distribution of heat in the breast tissue. Now, that's never meant to be a standalone exam because that's just physiological. Heat is showing you the result of something that's going on, and heat can come from inflammation, infection, and of course from breast cancer. Why is that? Because new blood vessels give off heat, and new blood vessels are always surrounding a tumor in order to feed it, and that's how it grows. When you first hear about thermography, you think, wow, the perfect alternative. But because heat comes from many different sources, even high estrogen can cause heat, and we live in an inflamed environment, so most of us are inflamed, it's not really the perfect standalone exam. It needs something anatomical to go with it so that when we see the heat, we can look at the tissue and tell where it's coming from. And I'll explain more of that when we get to ultrasound. Another factor to consider when having a thermogram is the first time you have these pictures taken, it's just a baseline. You don't know if you're getting worse or you're improving, and so you have your second thermogram and then can compare it to the first one and see if the temperature is going down or going up. Today, About 10% of our patients select breast thermography. Either their doctor has requested it or they've had one in the past and they're looking for their second comparative exam. They're on bioidenticals and they want to check to make sure that the estrogen levels have not increased and caused heat in the breast tissue. They have autoimmune disease. There are many reasons, but it's not the perfect exam for everyone. One of the things I want to clear up about thermography is that the camera is in black and white. All thermogram cameras are black and white. Then the user applies color, and like in these pictures here, this is a rainbow color to show the differences in the shades of gray, which is what is read by the thermography reading services. So green is nice and cool, blue is even cooler, okay, and red is obviously hot. So you can see how underneath the breast tissue will be hot, under the armpits will be hot. But normal tissue should be green. We don't see too much normal tissue, but normal tissue should be green, if not on the blue side. Here are two very good examples of a thermography picture, taken, of course, in black and white. It's pretty hard to see those vessels. They're circled here so that you can see them, but it's tough unless you've got the right equipment to read down to that vessel level. If we add some color, then you can kind of see how the red blood vessels are showing up there on the right hand side and how they just look a little twisted. Anytime something is not exactly normal, we do note it to the patient so that she can keep an eye on it. I don't want to overlook SureTouch. I found this technology in 2014 and used it for about 6 years. SureTouch would measure the density of the breast tissue and tell me where the density changes. Now, it shouldn't change, so if it does change, something's there. A cyst, a fibroid, cancer, something's causing this to happen. Now, we use this technology like a replacement to a mammogram. So mammograms find an area of concern, and then ultrasound looks to see in that spot what is it that's there. And we used SureTouch for that exact purpose. But like mammography, once we found an area of concern, we had to send the patient to ultrasound. So there was a two-step process. Today, I have removed that two-step, and we found a technology called Clarius Ultrasound in Canada. Due to its wide beam, we can now eliminate mammography and SureTouch. Ultrasound uses high-frequency sound waves, which are both painless and harmless, to actually take a picture or video of your internal organs. There are a few issues with the cart type machines that we use for ultrasound in the United States. The first one is that you have to calibrate for the different types of organs. So it's one machine for all the organs of the body, and of course each one is quite different than the other. The other problem is that the beam is very small. Great if you're doing a thyroid, great if you're doing a ultrasound guided biopsy, but not good if you're doing a breast exam. Would be like looking in a dark room with a flashlight. How do I know where to look? So when I found this Clarius ultrasound out in Canada, I was just amazed. I mean, you buy the equipment based on the organ that you're going to do. So here we have a breast calibrated ultrasound piece of equipment with a beam of almost 2 inches. No breast exam is perfect, and the only way to tell if you have breast cancer is to have a biopsy. But now I have a piece of equipment that's close to perfect. I've eliminated the need for a second step exam, and I've found a piece of equipment that's actually affordable, so we can pass that on to the patient for $150. As you can see in this picture, the procedure is simple. The ultrasound machine is cordless, it's handheld, it's on an iPad. You can see the pictures yourself on your own telephone, and it takes about 20 minutes, 10 minutes on each side. Our ultrasound techs are all extremely qualified. As you can imagine, a radiologist is only as good as the technician's pictures. So you want a technician who's taken not hundreds, but maybe 1,000 breast exams doing your test. With all that said, Clarius has a superior ultrasound imaging that you can trust. It's way more accurate than a mammogram. It's affordable. It's really a great option for women with breast implants or dense breast tissue. There's no radiation. there's no pain, and you walk out with your pictures and your results. So schedule with us. You can do it online at www.ocbreastwellness.com, or you can call us at 714-363-5595, and we'd be happy to schedule at your convenience.